relationships, sex, passion with Dr. Laurie Betito. Hear the show live weeknights 10 to 11 on CJAD 800.
Welcome to Passion, a show all about love, sex, and relationships. Well, today is Bell Let's Talk Day. You've been hearing about it all day. So our regular Trouble Tuesday this week will be on Trouble Thursday. We'll do it this way. And I'm happy that the day ends, the Bell Let's Talk Day ends with my Passion panel. I think it's a great way to end the whole day, to continue talking about it and maybe even talk about the hardest part, one of the more taboo subjects, which is sexuality and relationships and the impact of that. So it'll be, a little bit of a different angle. So we do talk about mental health issues. We're going to focus tonight a little bit more on anxiety and depression, which are the most common mental health issues of all. This is what most people consult for if there's a mental health issue: anxiety and depression. So joining me tonight, very special panel, is Sandra Reich. She is the clinical director of the Montreal Centre for Anxiety and Depression. Vicky Stark, who's an author and director of the Sedona Counseling Centre. And you've heard all these voices here before on my show, by the way. And Suzanne Deshotel, who is also joining this panel, who will share some stories with us here as well. And anything you want to add to the program would be also fantastic. 514-790-0800, or you can text us at 514-800. Thanks so much, ladies, for being here. I feel it's like another Passion View,
I know.
but with another, at a whole other level, Yeah. Vicky, I know I don't want to forget, so we're going to do this right away because sometimes I just start talking and I don't shut up, and then I, find that I don't have any more time left. So there's a wonderful Women's Health Initiative symposium happening tomorrow.
Yes.
Right? Tomorrow evening between 5 and 8. Tell us a little bit about that.
Yeah, well, this is going to be a really special evening. It's being held at the Royal Victoria Hospital. It's for women, and we're going to be having 4 mini TED Talks, TED Talk-like kinds of talks, with 4 professionals who work in the issues of women's health. So I am going to be starting the evening off talking about the secrets of a happy marriage, everything I've learned through my 30 years history of being a marriage counselor.
Right.
There are secrets. It's only secrets.
No, really, I'm going to be...
Poor Suzanne. She's like, why didn't I get the secrets?
I'm going to be laying it all out there. It's an all-woman audience with only one man in the audience because he's one of the speakers.
Speaker. Oh, wow. I hope nobody brings tomatoes. Okay.
And he... Dr. David Morris is going to talk about surviving perimenopause.
Oh, I like that.
And Dr. Nadia
Skrumalak, no?
Skrumalak, yes, is going to be talking about the Superwoman Syndrome. And
like that one
yes,
too. Well, that ties into a little bit about what we're
hear
talking about tonight.
What she has to say. And Dr. Julia Crane about domestic violence in women.
Wow, this is like a heavy duty.
Well, it's sort of
heavy duty, meaning like great feeding of the mind and learning.
Yeah, it's ranging all over the map.
Right. Well,
but it's going to be a really great evening, a fun evening. I think that there's just a $10 donation, so it's not very pricey.
Beautiful.
And it's held at the Royal Vic. People can go and visit the website, which is royalvic.com/events.
Great.
And it's early. It's from 5. It starts with a cocktail party, so everyone will loosen up.
That too. Okay.
And
It's
goes
always good with a room full of women.
Yes, it is.
And goes till 8. So anyhow, I think it's going to be a really fun and interesting evening.
Oh, it sounds absolutely amazing with 4 wonderful speakers with so much experience. How could it not be amazing?
Well, thank you.
Vicky, great, wonderful. And Sandra, you too, you have all kinds of events, just happen to be at one of yours tonight at the center. What, you're having something for women also?
Well, it's relevant now because we're starting to talk about how women are affected by giving so much of their power away. So I actually started a sub-company on empowering women because women tend to caretake others. And we're starting to talk a little bit about depression and anxiety. And the more you give to others, if you don't keep anything for yourself, your energy goes into a depressed state. So we are very fascinated with that topic. We do a lot of workshops, and we're about to do a big retreat for women on boundaries and consequences, which I would say is the immunization from over caretaking.
Right. And those caretakers are often seen as the superwomen of the world because they do it all. And I know one sitting right here who does pretty much all and everything and ran until she ran on empty.
Well, I did many years ago when I was still in television. I was driving back and forth to work. I had 3 little girls at home that I wanted to be with. But I had to come into work every day in the city. We lived far away. And I was averaging about 150 kilometers per day. And I was always racing against the clock. And I was sure every time I was heading home off the island, as I was crossing that bridge, I said, you're going to get an ulcer. Something's going to pop here. Because I was always just pushing and racing. I had to be here. I had to be there. I wanted to be with my kids. I knew I still wanted to work. It was pull me and push me. And I hit the wall. I literally hit the wall. Not literally. I was driving across the bridge, and the bridge, as I was approaching it, going at a fair clip because I wanted to get home, it all of a sudden changed form and extended into a tunnel. And as I saw the bridge getting longer as I approached it, of course, you start to freak out.
Sure.
And I remember I directly pulled over to the right-hand side, and I said, oh, my God, if I stop this car, I will never drive again. And I forced myself at 60 kilometers per hour. I still had about 20 kilometers to go. I drove all the way home. And the next day I called a doctor. And they said, you need to stay home and rest for 3 weeks.
Right. Diagnosis, burnout.
Yeah, right. Diagnosis, burnout. I went to work. They said, really? You're going to see our doctor. I went to see their doctor from work. He said, you're not staying home for 3 months or 3 weeks. You're staying home for 6 months. And we will reevaluate. I had just totally, it was just gone. There was nothing, I had nothing more
left.
to give. And as you mentioned, Sandra, women were caretakers. And I always said, I'll give and give and give, but I've got to get back. And I wasn't getting back. Certainly from my children, but that's not their job.
That's right.
It was my partner's job. It was and that wasn't happening. And I hit the wall. So I was off for about a year. Wow. And then as I understand it, once you've gone through this kind of thing, it can come back at you.
Right.
Yeah. Well, what's the secret wish of a caretaker?
Somebody come and do everything for me.
Yeah, the secret wish of a caretaker is to be taken care of.
Absolutely.
But the problem is the more we take care of others, the more they kind of go, this is a good deal. So they're not likely to come back and take care of us. That's the dilemma.
Right.
And it really is the secret wish of a caretaker, to be taken care of.
Absolutely. And I look around at so many women, in fact, every woman that you see, because we're all working these days and we're all taking care of families. And we're all, when you mentioned the superwoman syndrome, we all used to say back in the 70s and the 80s, we could do it all and we can have it all.
Can we?
No.
Can we?
And we shouldn't.
Very hard.
Right.
And we try to, and we put ourselves in these situations, and the business world has put us in these situations because we have to work harder, be better, get paid less.
We have to find a way to find that balance, and we can talk about that coming up. Right. Yeah. Join our panel tonight, Sandra Reich, Clinical Director of the Montreal Center for Anxiety and Depression, Vicki Stark, author and Director of the Sedona Counseling Center, and Suzanne Deshotel joining us tonight for Bell Let's Talk Day, and that's what we're doing. We are talking.
You're listening to Passion with Dr. Laurie Betito, the podcast. Hear the show live weeknights 10 to 11 on CJAD 800.
Today is Bell Let's Talk Day, right through till right now, actually. And in fact, Bell will donate 5 cents more to mental health initiatives for every text message and long-distance call made by a Bell or Bell-aligned customer, every tweet using hashtag Bell Let's Talk, and every Facebook share of the Bell Let's Talk image. So let's raise a bit of money for this important cause that we need to get mental illness out of the closet and talking about it. So helping me to talk about it tonight are Vicki Stark, who's an author and director of the Sedona Counseling Center, Sandra Reich, who's also an author, books coming out in March. Congratulations, Sandra.
Thank you.
And the clinical director of the Montreal Center for Anxiety and Depression, and Suzanne Deshotel, who's been telling a little bit about her story of years ago. And we stopped off by saying that when you have an experience of burnout once, burnout, depression, you want to call it what you will, it's crashing. Really? I mean, that's what it is. That you're more sensitive to crashing again, or more vulnerable to crashing again. So being sensitive to the signs, I guess, is really, really important. So how often, Vicki, do you see this, especially in women?
You know, the thing with women is that probably one of the worst things that you can call a woman is selfish.
That's true.
Women hate to be
Right.
called selfish. You know, for somebody to say, you're so selfish, you know, it just sounds like the meanest, most. You can say to a man, you're selfish, and he'll go, yeah. So, but for a woman, you know, to be called selfish is you know, it's really damning.
Right.
But when you think about the word selfish, what is it? What is the root is self? You know, she's taking care of herself.
And what's wrong with that?
And she's putting herself first. Oh, my God. And I think that so often, you know, we're trained, women are trained, you know, and we're socialized to believe that to be good, you have to be selfless. And that you can't take care of yourself first. So you have to take care of everybody else first.
And that's the recipe for crashing.
And that's the recipe for crashing. So that because people sort of, they internalize that concept that it's evil, it's wrong, it's selfish, you know, to care for yourself. It's very hard for women to be able to say, you know what, I'm not doing anything today. I'm just going to, you know, lie in bed and read a book. Or I'm going to, you know, I know you're shocked. It's pretty shocking. But we don't know how to do that. And to do it, we have to struggle with it so much. We want to hop out of bed and clean the toilet, you know, and then we'll go back and read the book.
Right.
So that, you know, and that's why this burnout keeps coming back. Because we need to retrain those neural pathways about the fact that it's okay.
This happened, not kidding, yesterday.
Okay.
I woke up after I worked in the morning, and then I had a whole slew of things to do, but I had a kink in my neck, and I said, you know what? No.
Yes.
And I stayed home, and it was cold, and it was blustery, and I did all my work from home, and I felt so terrible about it all day. And I kept saying to myself, no, it's okay. You don't have little kids to take care of. You can do this. You're allowed.
Right.
And I still can't get it into my head that I am allowed to do it. I'll tell everybody in the world that it's okay.
For you.
For everybody else.
Right.
And my mind knows that's okay. But
emotionally,
the connection's not happening.
But you know, when you go on the plane and they tell you have to put the oxygen mask on you first before you can help your child, it's a great metaphor. We really can't be there for other people if we don't put that oxygen mask on ourselves first. And I always tell people the story about the heart, the vital organ in your body. Do you know the heart pumps blood to itself first before it sends blood anywhere else? It's a great metaphor to consider for women, is that we have to take care of ourselves first to be those good mothers and to be there for the other people. So it's actually a gift to everyone around you. But we have a hard time with that. We have a hard time learning that.
We all know that. I mean, intellectually, we know that.
But we still feel guilty is what you're saying.
Yeah, so I think that leads to depression.
Yes, it does.
So we have to, how do we make it work?
But women do define ourselves in relation to our relationships. You know, for a woman to say, for example, I don't want to have children. That's like, you know, you don't say things like that. Like that women are trained to be constantly in relationship and to view themselves and assess themselves in relationship. But for a woman to be able to look at herself and say, what is it that I want? You know, I might not be able to get what I want, but let me at least articulate it. Let me at least know myself well enough to know, do I want to eat Chinese tonight or do I really want Italian? Or do I have to ask everyone else? Let me poll the whole neighborhood first. And wherever everybody else, you know, the majority,
consensus,
then we'll go. You know. But we don't ask ourselves first.
Right, that's true. Join our panel tonight for Bell Let's Talk Day. We are talking, instead of our usual Trouble Tuesday, we're focusing on mental health issues, which is not that different from Trouble Tuesday, frankly. But you can join our panel, Sandra Reich, Vicky Stark, and Suzanne Dizotel.
You're listening to Passion with Dr. Laurie Betito, the podcast. Hear the show live weeknights 10 to 11 on CJAD 800.
Bell Let's Talk Day. Tonight we talk about mental health issues. Do you know that during their lifetime, about 5 to 12% of men and 10 to 25% of women will have at least one episode of major depressive disorder? Females to male ratio 2 to 1, but we can talk about that. And 20% of patients visiting primary care physicians have depressive symptoms. The condition of nearly half of these may go completely unrecognized. And anxiety and depression account for 79% of all psychiatric diagnoses. So we are seeing an increased incidence of depressive disorder especially in people who are divorced or separated, and especially from Western countries, which is interesting. So there's something about the way we live our lives that is affecting this rate of depression.
Is the relationships and play that much of a role in depression? Or what role does fatigue play? Because I think women are tired. And I don't know if that's...
They're spent, though, in terms of the energy that they put into things. That fatigue is one symptom of depression.
One symptom, not a cause.
It's not. It can't. I mean, there's not necessarily one cause of depression, right? There's so many. We can talk about that, but there are. Look at all the factors that can have an impact on making us depressed. Look at, we talked about, Suzanne, all the things you might have been going through in one short amount of time. Let's say.
Do you want the list?
Well, you can give the list, but your list would be similar to a lot of other people's lists. You're not that different from a huge portion of the population that have their own lists.
It's
just
modern women. The
yes,
modern woman syndrome.
Exactly. The modern woman syndrome, or the superwoman syndrome, I call it too. And when things happen, crap piles up, and trauma and events and things, and we live in a generation too where deaths and illnesses and job insecurity and right?
But you raise the issue about divorce and separation. If the statistics are that roughly in Canada, 39% of first marriages end in divorce, and 60% of second marriages end in divorce, and what we're talking about is. I'm
smiling, so
she's
that's
smiling. Is the incidence of depression over the course of a lifetime,
right?
So that those people will have an episodic depression, which is a normative reaction,
right?
So that'll boost up the
numbers,
statistics.
Of course, that's absolutely true.
That's
so
like a grieving period.
Exactly, but it's a normal reaction to a separation or a loss.
You're listening to Passion with Dr. Laurie Betito, the podcast. Hear the show live weeknights 10 to 11 on CJAD 800.
It is Bell Let's Talk Day. Today, Bell will donate 5 cents to mental health initiatives for every text message and long-distance call made, every tweet using hashtag Bell Let's Talk, and every Facebook share of the Bell Let's Talk image. And it's a wonderful, wonderful initiative. I'm very happy to be part of this, where it is all about getting the stigma out of mental health, mental illness, and really talking about it. So we've been talking about it to some level all day long. I think every show has had some form of mental health talk today. So, and of course, Passion is really all about relationship health and all of that. So it's perfectly fitting for our show to do this as well. Tonight, our panel is Sandra Reich, who is a clinical director of the Montreal Centre for Anxiety and Depression, Vicky Stark, who's the director of the Sedona Counseling Centre in NDG, and Sandra is on the West Island, and Suzanne Deshotel, who's here, who has shared with us her own stories of running on empty and finally crashing at some point. I just don't know how anybody who works at that level with crazy hours that are inhuman, really, because everybody else is sleeping, and I've heard this from other people who work night shifts or who work off of everybody else's schedule. The body isn't designed for that, I think. So don't you automatically end up breaking at some point? It only makes sense to me.
You really get nasty towards the end of the day when you get up at 3 o'clock in the morning and
But
go
I think,
all day.
it goes back to that idea of being out of touch with your own internal messages. Mm-hmm. We think like it's so noble to keep pushing. Oh, I haven't slept in 2 days. Oh, I have a big important project I'm working on or something. That there's a nobility in bypassing the messages that our body's giving us.
Right.
When our body says you're tired, it's time to rest, and that kind of thing. And that we're not listening to it.
But
and so
how
that
do we
get
start
out of
listening to it?
There's a
What
good
do we
strategy.
need to do?
Step one, I think, is to ask yourself the question. I tell all my clients to say this: what do I feel and what do I need? If you can ask yourself that question throughout the day, that really makes a big difference. How often as women do we ask ourselves that question?
We're not, as you mentioned, we're not trained to do
No,
that.
but
We're
we do it
trained
for
to ask
others.
everybody else, but not ourselves.
But we can learn it. The brain can learn it. If you 5 times during tomorrow ask yourself, what am I feeling right now and what do I need? That will have a tremendous impact.
I'm writing that down.
Write it down.
Let's do it.
Do it.
Let's all do it.
We have somebody who wrote in night shift for 14 years. The last year almost killed me. Was a 3-month recovery. There's there's a burnout right
Well,
there.
night shift is also having an effect with the seasonal effect of you're not getting the sunlight. Your whole circadian rhythms are being thrown off. It's a good predictor of depression as well as or anxiety.
Right.
You know, we do need good habits also to immunize. We need good habits with sleep, food, and exercise. We've talked about that before.
Right. We need to really take care of. But again, it comes right back to what we were saying, taking care of oneself.
Yes.
If you have no time and say you have no time or do nothing for yourself, you're not going to eat properly. You're not going to get exercise because, you're too busy to go to the gym.
Yes.
You're too busy to whatever it is you need to do for yourself.
Yes, but that we were talking about that on the break. When we don't take care of ourselves in our relationships, that plays out as well. Because I was saying that our relationships are a reflection of how we feel about ourselves. So it's directly proportional to
You don't
how
like
much
that
we
one,
treat
huh?
ourselves. Well, therefore we
Say
have
it.
to come back to taking care of ourselves. How can we expect someone else to take care of us if we don't take care of ourselves?
Right. But what
It's
is
an
that? You
important
said
piece.
something important about loving thyself and the proportion. Just repeat that again.
Yeah. The love you give yourself is directly proportionate to the love you get outside of yourself. It's all coming back to what you feel about yourself. So if you're loving yourself and taking care of yourself, you're likely to draw into your life people who will do the same for you. If you're neglecting yourself, what are you going to draw into your life?
Right.
Someone who does the same. It doesn't start that way. It looks like they're going to rescue you, but it doesn't end that way. It's an important piece for relationships, the dance of relationships.
Certainly is.
I'm shaking my head in agreement.
Well, you've lived it.
Yes, I
You've
have.
lived it.
Yes.
Right. So you know that. I also want to talk about the impact on relationships. I think it's really important that we look at the person who doesn't have the mental illness, who lives with someone with a mental illness, whether it's depression or anxiety or OCD or whatever it is. The person who has it is suffering. The person who lives with him or her is also suffering in a different way, but and may also feel completely out of control, right? It's the way I see it is you have the person who's suffering feels like they have to put all of their energy into just trying to keep it together. So they have very little energy left for their partner. The partner starts to feel neglected.
Gets angry,
Gets
frustrated.
angry at the partner who can't help that he's or she is sick. And then it begins this cycle of resentment and push away and pull away and
guilt.
and guilt, yeah.
And tremendous guilt because, if you're living with somebody who is suffering from some kind of an emotional or mental illness, and you're not getting your needs met,
Right.
so that you're resentful, but you also are guilty because you know that you should be kind and you should be caring.
Right.
And so you're sort of trapped, and I know that a lot of marriages end around the time that the depressed person starts to recover.
Interesting.
Because then the partner finally feels as though, okay, phew, I can get out of here now. That this one's not going to go, commit suicide if I leave now because they're not as depressed. And that they themselves have been feeling trapped. So in some ways, that mental illness within couples it's really not possible for one person to be suffering from mental illness and the other person to not be
suffering also.
not be drawn. That in many ways it's contagious.
Right.
And
Interesting.
it can affect the whole family in that
Yeah,
way. It's
sure.
extremely important, which is I think if someone's suffering, it's the partner, even though it may not feel empathetic, has the right to say to the partner, we need to do something about this. It's going to affect the partnership and
All
it's
of
going to
us.
affect the kids
Right.
and the
Yes.
family. It's very contagious.
You're listening to Passion with Dr. Laurie Betito, the podcast. Hear the show live weeknights 10 to 11 on CJAD 800.
You're listening to Passion, and tonight we're focusing on Bell Let's Talk Day, so we focus on mental health issues, mainly talking about anxiety and depression and women and women's role in all of this, or the impact on women the life that we lead. And of course it has, bless you, it has an impact on everything else and the family and couples and relationships and all of that. My panel tonight, Vicki Stark, who is the director of the Sedona Counseling Center. By the way, you can hear her tomorrow evening at between 5 and 8 through the Royal Victoria Hospital. It's a Royal Victoria Hospital Foundation event. It's called the Women's Health Initiative Symposium. So it's taking place tomorrow. There are 4 wonderful speakers. It's a women's event. So you can check out at royalvic.com/events for information.
Bless you.
Thank you.
Somebody's got the
Sneezing on the radio. I think it's so fun. In 15 years, I've never sneezed on the radio. You know that?
Wow.
For some reason, the body goes into a, like, okay, this is not going to
zone?
happen. Yeah, it goes into something where even if I have a cold or whatever, it just doesn't happen. I think that's why I think it's kind of funny. She's suddenly allergic.
Yes.
So Sandra Reich is here. She's the clinical director of the Montreal Center for Anxiety and Depression. And Suzanne Dishotel also joins us. And we've been having quite a wonderful conversation actually on so many things, and there's just so much to talk about. I don't even know, and we're just like kind of touching the surface, and I'm kind of glad that we're focusing on women, and women are much more prone to depression, anxiety. We're getting a much better understanding as to why that is, and I think a lot of women can relate to what we're saying tonight.
And I think what's important for women to understand, especially in this day and age when we've pushed ourselves so far, is to, as you know, you were saying, Sandra, asking yourself what you want and what you need. I think it's very important in this day and age to finally say, I need help.
Yeah, so true.
And it got to the point with me where I was just battling everything. And I said, what am I doing? Why am I trying to do this by myself? I picked up the phone. I called my doctor. He says, I've been waiting for you to tell me that you need help.
He felt it, obviously.
But
Right.
he knew that I had, he couldn't, say, do this, do that.
Right.
I don't know why. Sometimes people are afraid of me. I don't know what that's all about.
Oh,
But,
you're just a strong woman, that's
no.
all.
But he, as soon as I said that to him, and it was like a Friday afternoon at 5:00, and I just went, he says, all right. He says, this is what we're doing. And he just went into
tackle
motion
this.
immediately. And helped
And
me.
that was a real act of courage on your part to reach for help. Women sometimes think that's weakness. That's an act of courage.
For someone like me,
Yeah.
it was like that was very difficult. I mean, I struggled with that for weeks before making that phone call.
It's very courageous.
But it
Thank
sort
you.
of raises another frisson, another element in all this, which is friends.
Mm-hmm.
What do you do if you notice that your friend is depressed?
Right.
A lot of times people are afraid to raise it with a friend.
But-
They're afraid to say things. They're afraid that their friend is going to be angry with them. They don't want to overstep those boundaries. So that even though sometimes people have a hard time asking for help, sometimes they're hoping that a friend or a relative will step in and...
But people will hide it. I mean, I have that ability.
Yes.
I mean, you would never know.
Yes.
I can still go out. I still function. I still laugh.
Yes.
I still,
Right,
I,
right.
I can do all of
Right.
that. But when I'm alone, and I will hide it. So nobody knows. Nobody
Yes.
knew.
Right. Yeah. No.
And I made
definitely
sure.
that's
and
So
I made
nobody, right? So
and I
nobody
made
was going to
sure
reach
I
out
hid
to
it.
you, right?
Yeah. So nobody would have been able to come to me.
And I think that's quite common. I think that's really, really, really common. And many times I will see clients and I will look at them, especially men who tend not to go for help. But let's say they come in for couple counseling or what have you, and I'll see it. I'll say, "Wow, looks like you're suffering from depression," and then they start to come out with all the symptoms that would indicate, yeah, maybe, maybe. And then you see all the...
But sometimes you don't know. I remember,
Right.
just being a post after giving birth to one of my children. I thought it was fine. It was functioning. And my doctor looked at me, and which is a very common thing, postpartum, right? I mean, everybody has the blues. Your hormones are going all over the place. And he looked at me and he said, how you doing? He's never asked me that before, And I said, why? I said, I'm fine. And he started to ask me all sorts of questions. I said, why are you asking me these questions? He says, I've known you a long time. He says, and your eyes are dead.
Ooh,
Oh, wow.
Yeah.
Oh, wow.
Yeah.
that's observant.
Yes.
Let's
And that's
stick
what he
with that,
said.
doctor.
Let's talk about what's going on.
And it sounds like also you're describing, different periods in your life where this has happened, that there's something to be said about someone being vulnerable to this kind of illness, right? We know there's genetic component to it. We know there's a genetic basis for it as well as the environment. So we're learning more and more about mental illness, its roots, who's more vulnerable, who's less vulnerable, who's more resilient, why, and what are some of the things that can trigger it. So
and how it manifests very differently
in
between
everybody,
men and women,
and also
factor.
between people.
Yeah.
You know, it's not a one size fits all.
No.
What can drive you over the edge isn't going to drive someone else over the edge, and what, you know, so there's just so many factors.
But I think, Sandra's, raising something very fundamental that, it's important to get out there, which is that very often, that women, if they're depressed, they cry.
Yes.
But men don't necessarily look like they're depressed.
No.
They might look irritable. They might look angry, frustrated. They might be complaining about work. And it's really depression.
Right.
Watching more TV. There's a lot of
Computer.
signs, drinking more often,
Right.
being more on the computer. It's not obvious in a male. And that's why men often don't think they are depressed when they are depressed.
And they go undiagnosed.
Well, what do
Exactly.
they think is going on when they feel like that?
They think there's nothing wrong.
They
And
think
the
there's
problem
something
is
wrong
it's
with their
still
wife.
going to be affecting the whole family.
That's right. They think it's
always
blame
somebody else. Okay, I
else.
gotcha.
Let's hear from Bannon on the line. Hi,
Hi, how are you?
I'm good. How are you?
All right.
Good.
It was me that texted in before about working for 14 years at night,
Okay.
and I also worked the weekends.
Wow.
So what that did was you don't go to any weddings or birthday parties or funerals or everything, and you end up living in your own little world where, the only thing you want to do is, drink coffee and smoke cigarettes and go to work, right?
So you have, in other words, what you're saying is you have no life because you miss out on absolutely everything, and
You're
you
isolated.
live in your own little bubble, and isolation causes depression. There's no question about it. Plus everything else, right? Your fatigue, and it's like a perfect recipe for that to happen.
And
Yeah.
where I got lucky was that my girlfriend worked in the medical field, so she understood, night shift and shift work and everything.
Right.
And that's what really got me through. Without her, oof.
Well, there you go. That's what we're talking about, people around. Thanks so much for sharing and calling us. Have a good night. That's, such good points, really, that the kind of life that you lead, and sometimes you don't even know it. You don't know it.
You're so wrapped up in your
Yeah.
in your reality that you can't take that step back
Right.
in order to get that perspective to be able to say what's happening here.
Right. Right.
And we are social creatures. So I heard something about isolation. The worst
Right,
thing
he has
you can
no
do to a
life.
prisoner is put them in isolation.
Right.
It really is a recipe for a disaster. Whether we like it or not, we do need to connect with other people.
Right. And that connection is, but we need to connect with. The depression makes you isolate yourself.
I know, that's where it's a vicious circle.
It becomes this whole vicious cycle, and so important to reach out and
Like you did, and ask for help.
and
Good
talk. Yeah, it's true. Very, very, very important. And I think, Vicky, you brought up a good point too, because if you do see a friend who looks like they're suffering, I do think it's important to talk about it. This is the whole point of Bell Let's Talk Day. Let's not pretend it's not there.
Yeah.
Exactly.
Right? Let's not put a smile on everybody and just let's ignore it and hope
It'll
it
pass.
all goes
It's just
away.
a bad day.
Right, it's just a bad day. But when you're close to someone and you see it, I think it's important to speak it. Say the words.
Yeah,
Speak it out loud.
100% is very important. And even if the person says, no, it's nothing, and you know that that's not true,
Right.
that sometimes you have to be gently persuasive,
Right.
To really say, it's not nothing, I'm not buying that. Let's take a
Can
little
we
bit.
look at that? Right.
Yeah.
Let's talk.
Yeah, and I've done that. I've had that same conversation with friends too.
Oh, really?
That and I've pushed them into, like, said, okay, you need to go see somebody, please. Like, it can't be me. Obviously, you're my friend, but go see somebody. And Sandra knows because I've referred people to her. And it's important. It's important that we say it, we talk it, we give it a word, we give it a name, and we get the shame out of it. And we've run out of time. That's it.
Wow.
Guys,
Imagine
thank
that.
you so much for being here. And Suzanne, I know not easy to share struggles out loud and say it out loud, but I think you're an inspiration to a lot of people, frankly.
Indeed.
Thank you.
I really do. And you're a very strong woman, and that's the inspirational part for me, so to handle all that. Sandra Reich, Clinical Director of the Montreal Center for Anxiety and Depression. Where can people reach you, Sandra?
514-777-4530 or www.helpforanxietydepression.com.
And Vicki, for you?
I'm at the centrasedona.com, CENTRE Sedona, SEDONA.
And you can go visit Vicki tomorrow. Women's Health Initiative Symposium 2014 at the Royal Victoria Hospital. That's so you can meet her right there firsthand. Thank you all for tuning in on this Bell Let's Talk Day. We'll have our Trouble Tuesday on Thursday, so look out for Trouble Thursday just for this week. You can follow me on Twitter at Dr. Laurie Sex Talk, or you can follow me through Facebook as well. Thank you to Tim Carbray in Master Control and to all of you. News is next, followed by the CJAD Comedy Show. Have a great rest of the night, and please remember, life is short, so make sure you take the time to smell the flowers and indulge your passions.
Listen to Passion with Dr. Laurie Betito, live weeknights 10 to 11 on CJAD and CJAD.com.